Hi, my name is Paul Secor, and I'm the Vice President of Philanthropy for the Mental Health Association of Central Florida. And we're here today celebrating World Mental Health Day, taking a deep dive into how mental health affects different communities, different groups, and different demographics. With me today is my coworker and colleague, Lisseth Russa. So, Lisseth, if you could introduce yourself and tell people what you do at the Mental Health Association of Central Florida.
Yes, Paul, thank you for having me here today. I'm happy to be here with you in this interview for World Mental Health. My name is Lisseth Russa. I'm the Vice President of Operations of the Mental Health Association of Central Florida.
All right. Hey, let's dive into. You're going to be talking to us about the Hispanic community and how it relates to mental health. But before we jump into that, tell me about your background and what motivated you to get involved in mental health.
Yes, so Paul, I've been with the Mental Association for a little bit over 2 years, but I've been in the field for a little bit around 20 years now in social services and in mental health. Ever since I was a young girl, I think I had a call. I had always wanted to be in social services, helping others, and human behaviors always was something that interested me. And I was always the one that drawn to for individuals to come to for advice or if they wanted to talk to me about something. So it had always kind of been in my nature to do so.
Okay, so you're the person that always had like, I got to talk to Lisa because she'll steer me in the right direction.
Yes, I always try to mediate between people too all the time. So
All right, and now you turned that into a career, so that's a great thing, right?
yes, and well, being in mental health, even though I currently don't practice, it does help me right now in my current role with my staff when I have issues and I have to try to resolve it with them. The mental health background really helps me in that situation.
Okay. Well, one of the things with mental health that we look at is, a predecessor to having mental health issues or potentially struggling with your mental wellness is dealing with different stressors. And one of the things that we found by doing these interviews is it seems that different groups, different demographics experience vastly different stressors, but those stressors are shared by that community. When it comes to the Hispanic community, what are some of the stressors they face that might affect their mental health?
So overall, in general, everybody deals with the stress in different ways, right? And then that's the same when it comes to culture or when it comes to the Hispanic community. But we have unique stressors that we have to experience on day-to-day life, such as, speaking a different language or learning a different culture, adapting to a different lifestyle, as well as immigration. So there's a lot of other stressors that are very unique to a Hispanic community, but it could be also, other communities that are of minority background.
All right. And we know that there's a stigma in general when it comes to mental health. It's not seen like physical health. So if you go to get a checkup, your leg's hurting you, that's different than if you're dealing with depression, right? And so people feel like there's a stigma about stepping forward and kind of admitting and talking about what they're going through. But one of the things you and I've talked about, we've talked about in the office, is there seems to be an enhanced level of resistance in the Hispanic community when it comes to mental health and even a bigger stigma. Talk to me about that. Why is that, and how does it manifest itself?
So that has a lot to do with how we were raised and our backgrounds, and the negative beliefs that we had taught and raised with while we grow up. A lot of our families and our ancestors were not used to mental health being a thing. If you had some type of issue or if you felt some kind of way, it's just rub it off and keep going, move on. You don't have the time of the day to just focus on those things. Those are minor according to our culture. So it comes from that background and from that idea that mental health is for crazy people. And that's how I say it. I'm not crazy. So I think it's a lot of educational that we have to do with our families and with our communities, that mental health is just part of your health, just like having a headache or having a stomach ache, that we have to take care of. But having to break out of those negative beliefs is the tough situation. It's the challenges that we encounter because it's an ongoing educational thing that we have to do with our community. It starts with us, the people that are already in it, with this generation, with past generations, with our families, trying to teach them why this is important and why mental health is a thing.
You know, interestingly, like a lot of all the services that we offer at the Mental Health Association are free of charge. They're totally accessible by people. But what do you think? I know we often talk about, hey, we just need to tell people it's okay, and we do that. But what are additional things that we can do to connect the Hispanic community with more services, make them feel understand the importance of it, and really get value from it? How can we break through that barrier, do you think?
Again, I go back to the educational piece. It's going back to the communities and talking to them a lot more and more about what the services that we offer and why that is important. There is a lot of situations in which Hispanic families encounter that they don't realize how important it will be to having that mental health professional work on that issue. Something so simple as just adjusting to a new culture. It's an adjustment disorder that you could work on, and that doesn't necessarily mean that you're crazy. It doesn't necessarily mean that you're going to have a long-term sessions with a therapist. It's just a means to help you cope with that situation in that moment. And we go through different circumstances throughout our lives in different kind of ways that it would always be helpful to have that professional help. And again, it doesn't mean that I'm crazy. It just means that at this time in my life, I will need this individual to help me cope with this specific situation, the stressors that it relates to it, or the anxiety that goes behind it. But it's accepting that help, accepting that it's okay to speak to somebody else. And within the Hispanic family, what we do a lot is it stays here. It doesn't go out of the Hispanic circle. And that's when it becomes a problem because it's not the same as having your mother or your father giving you that advice because they're not going to be objective about it, right?
Yeah.
It's good to have that outside professional eye looking into what your situation is and giving you that professional advice and guidance as to how to cope with that situation. So education is really important in us letting the community know why mental health is important and why you should be open to it.
At the Mental Health Association of Central Florida, we do a lot of events. We do over 100 events per year. And it's interesting, you and I have been at events and and this doesn't happen all the time, but it happens some of the time where we have a Hispanic family come up and they all of a sudden learn this is a mental health table. And it's like, they're trying to get away from the table as quickly as possible. Doesn't happen all the time, but it happens some of the time. And they, no, I don't need this. Um,
Yeah.
do you
I've
feel,
gotten that response several, and I'm sorry that I cut you
yeah,
off, but
no,
I got that response several times. There was a specific event that I went to, and I remember it was in Kissimmee, and I'm not going to say the location, but we were asked to be there for the employees that were there because the majority were Hispanic at that location. And they wanted to bring those services over to them and
mm,
try to remove that stigma of mental health. And the moment they passed through our table, immediately the reaction was, I'm not crazy.
yes.
That's what the first thing they would say. And it would baffle me to know these services are really good for you. They're free. You don't, we take individuals without insurance and you are acting this way. So yeah, it happens.
So with that, do you think, I know that's the reaction, but I'm hoping, like in marketing, right? They say if you hear something 3 times, then you're more likely to take action on it. If you repetition, that's why you hear commercials all the time. Do you feel like getting out there and doing that message over and over again? Number two, directing it to the Hispanic community, going into events, going into businesses which have a high Hispanic population among employees or high Hispanic population in that community. And then lastly, getting other organizations that serve involved in this, not just us, but other mental health organizations. Do you feel like that can make a difference? Or are we still going to be like just kind of pushed away from the table no matter how many times we do it? What do you think?
It is definitely going to be a long, ongoing process. And it's one that has been my goal for the past, I want to say 2 years since I've been at the organization. Because again, like I said, we have all the services that are completely free to the community. I'm thinking about my Hispanic community, the immigrants that come into this country with not knowing the language, with no insurance, with having all different kind of issues mentally, then not being able to solve them because they don't have the resources. It's been my goal to share with them we're here to help and here are the services that are good for you and to share that word over and over again. Now, we could do it as much as we can. It's really tough to break that cycle. It's really tough to break the cultural beliefs that they already have. But we could get there. I mean, as long as we get one person at a time, I feel accomplished, you know.
Yep,
And I think that we are far away into that process now, but we're not even close to where we want to be.
that's true. But and I think we got a shot with the younger generation too, I think, right? The younger generation
Yes,
will embrace this more. And so that family that we saw that might have pushed away from the table, that teenager there might have just picked up a brochure or remembered our website or something. So you never know like who we're touching when we're doing that.
correct, correct. Or maybe the other way around, unfortunately, that youth or that adolescent needs the help and needs the services, but because the parents don't believe in it, he's not getting the service that he needs. And unfortunately, we have seen a lot of situations where they die by suicide because
Mm,
they feel hopeless. And we
yeah,
have to understand that it's important that we listen to our youth. It's important that we provide them with the necessary tools, with the necessary information, the necessary help, so that they could get the assistance they need.
that makes sense. We've had some interesting conversations about representation in the mental health field, and you have talked to me and said, "Hey, I think we have a really solid representation by Hispanic professionals in the mental health industry, which is great." And I think we see that too at different events and things we go to. But one of the things that crops up for me as a question is, I feel like we define Hispanic culture as this big giant lump, right? And it's just this one thing. But really, Hispanic culture is composed of so many different countries in so many different geographic areas. You're from Colombia. We have a huge Puerto Rican population in Florida as well. But the experience of somebody growing up in Puerto Rico is totally different than the experience of somebody growing up in Colombia. And although you're both Hispanic, you have cultural differences for sure. So my big wind up to that question is, do you feel like it's important to be able to connect people from a shared experience, from a shared specific culture in their mental health journey? Like, would it benefit, you're from Colombia, and if you were seeking mental health assistance, would it be beneficial for you to be able to work with a Colombian therapist? What's your take on
Absolutely.
that? Okay.
Absolutely, 100%. I feel that it's really important for the individual to connect and understand our culture. And there's certain things in our culture. I'm going to speak for the Colombian one because it's obviously I'm Colombian. In our culture, that maybe a Venezuelan or a Mexican or a Puerto Rican is not going to be able to understand. And so only another therapist that is Colombian will be able to understand what certain situations are happening or what certain things are occurring within that family unit. But because I understand the culture. So that is extremely important. I think in order to have that representation within the different agencies in Central Florida area, we have to be aware that that's an issue, that as leaders, to understand that it's important to have that representation within our organizations so that we could serve the minorities in our communities. There's a lot of mental health agencies and a lot of organizations that I know that are primarily white individuals or primarily a certain specific community, but then you're not serving the entire community because you could only relate to a specific background. So I think as leaders, we do have to be aware that it's important to have the representation within the organization so that you could service the community at large.
Yeah, I think is a great point because I think that when you go onto websites too of mental health therapists in the area, a lot of times you can tell probably they're Hispanic and then they say, oh, speak Spanish as well. There's a statement on their website, but you oftentimes don't have an idea of what country they hail from, what culture they grew up in, or anything like that. I feel like it'd be so much more powerful if that could be on the forefront, because then I think people would naturally navigate towards that. Would you concur with that?
Absolutely. We did have a situation actually where one of our Puerto Rican therapists had a family from Honduras, and he was having a hard time understanding their language and his
Mm,
Spanish. So imagine, just right there is a good example of how important it is for us to be able to have as close as possible as we can a representation of the individual within our organization. And if we know that we don't have it, then refer them to wherever they can get that type of service. But we definitely need to try it as much as we can have that representation.
Okay. Well, we covered a lot here. Did I miss anything? I know like we try to do this like in 15, 18 minutes, Hispanic culture and mental health. Is there anything you think we missed or we didn't cover in detail?
No, I think I just want to say the last words is to my Hispanic community. We do have a lot of services in the Mental Health Association of Central Florida that are very helpful to you. Our Connections program, for example, if you're looking for any type of service, not just mental health, but food assistance, legal assistance, you name it, you could contact us. There's Spanish-speaking individuals also waiting at the other end that could answer your calls and help you find those resources that you need.
That's very true. And it's all free. And there's so much, right? When you think about it, like free therapy, free support groups, free referral services. So yeah, we're just a phone call away. So
Yes.
that's a great point. Well, thank you, Lisseth, for helping to celebrate World Mental Health Day with me. As you mentioned, visit MHACF.org to get more resources and stay tuned for more videos like this. We're all about trying to dive a little bit deeper as we explore mental health here at the Mental Health Association of Central Florida. Thank you.